Now, when I was up in Montana, I gave a speech, and I called it How Mental Health Advocates Mislead Politicians. But because this group features both mental health advocates and people in criminal justice, I wanted to do something a little different. So what I'd like to talk about is how mental health advocates can learn from criminal justice and the judiciary. Now, traditionally, we all blame police when there's a shooting, or we blame the correction officers when somebody is mistreated. But I would like to suggest that there is a lot of things we can learn from criminal justice. And this is particularly weird coming from me, because I grew up as a hippie. There's me. I still consider myself one. And questioning authority is kind of our DNA, and nobody represents authority more than those in criminal justice. But I kind of got turned around on this. I have responsibility for a family member who has serious mental illness, and that made me realize that police go where the mental health system won't, to the aid of the seriously ill. And it is for this reason that if we listen to criminal justice, we can start improving the treatment system. Now, to put this in perspective, I am not a mental health advocate, and that's why what I'm saying is different from what many of you may have heard. I am an advocate for people with serious mental illness. And to put that in perspective, 18% of the population 100% of the population can have their mental health improved. 18% have something in the Diagnostic and Statistical Manual, and 4 or 5% have a serious mental illness, meaning one that creates a functional impairment that prohibits their ability to engage in daily life activities. Now, in terms of numbers, there are about 250 million Americans over 18 who can have their mental wellness improved. 43 million approximately have something in DSM. A lot of that's minor, anxiety, mild depression, ADHD, but 11 million have a serious mental illness. Now in Louisiana, this tracks out to being about 3.5 million people in Louisiana over the age of 18, and I'm only going to talk about adults. It means 630,000 have something in the Diagnostic and Statistical Manual, but there are 4% with serious mental illness, meaning about 140,000 K. And the significant elephant in the room is that of those individuals, about almost 50,000 Louisianans with serious mental illness receive absolutely zero care. And that is the elephant in the room. The mental health system does not treat 50,000 Louisianans who have serious mental illness. Now, there are some nonprofits trying to help people with serious mental illness, and you've heard from some of them. John Snook at the Treatment Advocacy Center, my own group, Mental Illness Policy Org, Cheryl's group, and Healing Mind NOLA of Janet Hayes, who all of us around the country have really come to admire for what she's doing here. And what many of us kind of know is that judges, district attorneys, and law enforcement officers are our best hope for change. They are our best hope. They are the ones, because the mental health system is offloading the seriously ill to criminal justice, they have become the experts. So for instance, the Treatment Advocacy Center has done a lot of reports with the National Sheriff's Association, the International Association of Chiefs of Police. I've spoken at the National CIT Conference, the Mental Health Court Judges Summit. I'm currently working on an article for Sheriff's Magazine, and Healing Minds has obviously done a lot of work in this area, including this conference. So there are people with serious mental illness. The mental health system is ignoring them. This is John Hinckley. As you know, he shot President Reagan because he knew, not thought, he knew that was the best way to get a date with Jodie Foster. He had come in contact with the mental health system previously. He was left untreated. That we can debate whether it's 4%, 8%, 5%, whatever, but this is serious mental illness. These are the people that we're failing. And the reason we're failing them, what's important to recognize, is that the mental health system no longer focuses on the seriously ill. And in fact, this is the premise of my book, that the mental health system itself has abandoned the seriously ill, and it is that us mental health advocates who are responsible for that fact, and that is why the mentally ill are being offloaded to criminal justice. Now, what this chart shows is this is the total state spending, the amount states are spending on the mentally ill over time. And as you can see from the red bar represents mental hospital inpatient spending, state hospitals, and the blue bar is community mental health spending. And what you see is that in the two-thirds of spending used to go to inpatient care. Two-thirds went to inpatient care, right, and 1/3 went to community spending, and today that's largely reversed. The state spending is now going to community programs. And what you see, though, is that that's not where patients are going. And this is a chart similar to one John Snook presented, except I just showed a straight line rather than year totals, but patients are moving from hospitals, which are going down, to jails, which are going up. And if you add total institutionalization in 1960 and compare it to 2014, the numbers are roughly the same, largely with homelessness making up the difference. So those people who argue for closing hospitals, saying it reduces institutionalization, are wrong. And somebody presented data here that in Louisiana, apparently you had 250 people hospitalized before they closed the hospitals, and now all those people have moved to jails. That's a very distinct, very predictable national trend. The other problem we have is that, yes, there were investments in community programs, but we have to understand community programs generally will not serve those so seriously ill that they would otherwise need hospitalizations. And Dr. Akia is here, and he represents Fountain House, one of the terrific programs which will serve the seriously ill, will stick by them no matter what problems they encounter along the way. I think they have a motto, membership for life, and the Clubhouse program is an exception to this rule. But community programs will exclude someone because they're homeless, they don't have an address, because they're substance abusers, because they have a criminal history, because they don't have a family advocate to help them get into the program, because they're too old, the program was set up for youth, or because they're too young, the program was set up for elderly, and somebody in the prior group mentioned, or they have a behavioral health problem. So community mental health programs have largely abandoned the most seriously mentally ill. And the result of this is that criminal justice is now running a shadow mental health system. And Chief Biasotti, he's head of the New York State Association of Chiefs of Police Committee on Serious Mental Illness, he testified to Congress. He said, we have two mental health systems today, and it was in front of Congressman Murphy, who just walked in front of his committee. Congressman Murphy was nice enough to invite Chief Biasotti to testify. He said, we have two mental health systems today serving two mutually exclusive populations. Community programs serve those who accept treatment. Many who don't become a law enforcement responsibility. The mental health system pretends this second group doesn't exist. The result of all this is that criminal justice is now the experts. It is interesting that once you're incarcerated, you have a right to treatment that because of a Supreme Court decision that you don't have until you get incarcerated. There is no right to treatment for the mentally ill unless you get incarcerated. So there is this mental illness to jail pipeline that we all know about. The mental health system feeds people in, and it's diverting the seriously ill. It is offloading them to criminal justice. And we've seen some of these stats before, but I am going to use them to show that they demonstrate the expertise within criminal justice systems. The criminal justice system, judges, police, district attorneys, prosecutors, defenders, have encountered in a year 392,000 seriously mentally ill who are incarcerated. They all went through the criminal justice system. 750,000 on probation or parole. 140,000 seriously mentally ill, not just mentally ill, seriously mentally ill who are homeless. There are tens of thousands of competency hearings. There's, somebody mentioned earlier, the NGRI, not guilty by reason of insanity defenses, scuffles right within the courtroom. In New York City alone, police went on 165,000 emotionally disturbed person calls, and it's actually up, Cheryl's pointing. What is it now? 197. And by the way, if you want to evaluate your mental health system, you should require your mental health system to report on these metrics. How many mentally ill are homeless? How many EDP calls are police going on? How many mentally ill are incarcerated? And maybe even allow criminal justice to bill mental health departments for the cost of those. Because these are people, what a lot of people don't understand, if somebody with mental illness gets arrested, that's a success for the mental health department. You went off that budget and onto another budget. And I know somebody earlier said the two biggest reasons to care for people are safety and economics, or for the individual, it's the right thing to do, and the economics. But economics is often tough. If they're going off one budget, like off a state onto a federal or vice versa, nobody really cares about those costs. It's only costs for your own level of government and your own branch. Treatment Advocacy Center did a report and said that sheriffs and police just transporting people between hospitals and jails and courts and competency hearings was, in 1 year, was 5 million miles. That goes around the earth like 200 times, and it was almost $1 billion in cost. So criminal justice has become the expert. Now, I go to a lot of conferences. Half are criminal justice and half are mental health conferences. Let me say that the criminal justice conferences, including this one, have a lot more relevant solutions. When I go to criminal justice conferences, and we've heard that here today, what do they want? They want to be able to get someone treatment before they become danger to self or others. They want an easier civil commitment. When they take somebody to a hospital, they want that hospital to admit the person, not tell them there's not a bed, and they want the hospital to keep the person long enough to be stabilized. And before releasing that person, they want them to be made sure there's a process to keep them in treatment and to give them housing. That is a brilliant prescription for change. Now I go to mental health conferences, and they talk to me about things like, well, we have to end stigma, and we need to educate the public, and we need more peers on advisory boards and trauma-informed care, and we have to train police because we're so smart, we got to train police how to handle the mentally ill. I want the police to train the mental health system to stop abandoning the seriously mentally ill. So we should be listening to law enforcement officers, judges, and we need those three things. We need easier to meet civil commitment for a very small group of the most seriously ill. Most people do not need any form of civil commitment. Even the 18% don't need, the 4% don't need it, but there is a small group that does. And right now our laws require someone to become danger to self or others rather than preventing them from becoming danger to self or others, and that's pretty ludicrous. We have to change that. Think of seatbelt laws. We would never do that. But we mental health advocates, we claim the mentally ill are no more violent than others. We create an incentive for government not to take steps to reduce violence. After incidents like Parkland, Virginia Tech, Aurora, Colorado, most recently in Midland, Texas, and Odessa, Texas, we bring out our most popular claim. We teach everyone the mentally ill are no more violent than others, something the courts are seeing violent people every day. And it kills me because we in the mental health business know that untreated, seriously mentally ill are more violent than others. Psychiatric units are locked, liver units aren't. Psych nurses wear panic buttons, those in heart units don't. Our outreach teams go out in pairs for their own safety. We're teaching police to deal with people who have mental illness, not other illnesses. So of course the seriously mentally ill, the untreated seriously mentally ill are more violent than others, and when mental health people deny that, rather than asking government to take steps to reduce it, we're inhibiting care. So I would ask the judges and law enforcement, believe your own eyes. Do not listen to mental health advocates. I want you to be independent and react and help change things that you're seeing. I'm going to go quickly through how the mental health people make this claim that the untreated seriously mentally ill are not more violent. They're studying the 18% who have any mental illness rather than focus on the 4%. Now, I think when somebody says, are the mentally ill more violent than others, they're not thinking about the guy who has anxiety or their coworker who's on Prozac or Zoloft. They're thinking about the seriously mentally ill. They study only the treated. Almost all these studies are done by recruiting people from treatment programs. So these are being treated. All the studies are showing is that treatment works. If you want to know if the mentally ill are more violent than others, study the untreated. And finally, they exclude the violent. This was what was done by the MacArthur study, which is considered such a great study. MacArthur only studied people in the community. That means they excluded those in jails, they excluded those in prisons, they excluded those in hospitals, they excluded those in forensic hospitals. I'm not sure whether they excluded those in shelters. I will concede that if you exclude this untreated, seriously mentally ill who are violent from your studies, you will find that the remainder are not more violent than others. So we have to work on some of the things that the criminal justice system is saying we needed. The first one was they need easier access. They don't want to wait till people are dangerous to offer them treatment. That means we should be offering things like, and I don't know what they are here in Louisiana, but a grave disability standard, a need for treatment standard, lack of capacity standard. We have to be able to hold people long enough to really get them evaluation. And this one I do know you have a problem with. I may be confusing Montana, but who can petition for treatment? Is it only professionals, or can a family petition for involuntary treatment? To get what we're calling for, which is easier access to civil commitment for a very tiny group, and I gotta keep expressing that, we have to stand up to the ACLU, we have to stand up to Bazelon, Mental Health America, Disability Rights, PAMI, Summon NAMI, Radical Peers, the Center for Mental Health Services, and all these others who believe that being psychotic and delusional is a right to be protected rather than an illness to be treated. So everybody wants to get along and work with others, but where we have a disagreement, what that brings us to basically is working on the lowest common denominator. And if we want to focus on the seriously ill, sometimes we have to go out there alone. Listen to the sheriffs who are supporting hospitals instead of jails, and that point's been made better by other people today who have been talking about how this has gone down. how the hospitals have gone down. The number one thing to do, two things: you have your state is closing hospitals, and also you have the federal government. And people always ask me, I tend to focus, and my book is all about the problems, and then here are the specific solutions. And people always say, well, what should I work on? And I say, work on whatever you're passionate about other than stigma, which I'll get to later. Work on whatever you're passionate about, but go deep. Become the expert, become the go-to person like Cheryl has done in New York. We need people who have expertise. And again, Congressman Murphy did a great job of reaching out to people who knew solutions when he proposed his bill. So the IMD exclusion, it's federally sanctioned discrimination against the seriously mentally ill. Now, some people argue if we end the IMD exclusion, i.e. we allow Medicaid for hospitals, we're going to create this massive institution and these horrific institutions and stuff like that. That's not reality. The institutions became horrible because they couldn't get money. Relieving the IMD exclusion will allow them to offer care that's truly therapeutic. It'll allow them to hire case managers to start outplacing people appropriately versus what they're doing now, which is discharging people inappropriately just to free up beds or comply with Olmstead agreements. So to support hospitals, stop your state from closing them. Ask this is important, we can't be click activists. Well, I did a tweet saying that, we should end the IMD exclusion. We got to reach out to the politicians. So ask your senator, ask your representative to eliminate the IMD exclusion. Ask your state legislature to pass a resolution calling on the federal government to eliminate the IMD exclusion. Same with your sheriffs and your police and any organization that will pass a resolution asking the feds to do this. By the way, a lot of people like passing resolutions because I'm not requiring them to do anything. So it's not that hard a lift to get that done. Somebody talked about there is a waiver process now, I think John, that allows all states to apply for a waiver to use IMD funds for hospitals. It's a difficult process, but you should try to do it. Fight the Olmstead agreements. I'm not going to explain what they are, but basically you have federal lawyers who are going in and walking around hospitals and saying, do you want to leave? Yeah, okay, and now they're letting that person leave, whether they're ready for it or not. The law enforcement is saying they need people to stay in treatment once they leave the hospitals, and very few people need long-term hospital care. They may need it for a month, they may need it for 60 days. I'm not advocating for long-term hospital care, but we're short over 100,000 beds. I think I calculated somewhere, I don't know if I skipped it, how many you're short in Louisiana. So two ways to get people to stay in treatment are assisted outpatient treatment and mental health courts. Assisted outpatient treatment is simply the most effective program I know to reduce rates of homelessness, arrest, violence, incarceration, suicide, and needless hospitalization in people with serious mental illness. No other program has been researched as extensively, and it's interesting, it's researched extensively because the opponents say it won't work, and so they keep demanding more research. So this is research from New York, but it is held up in every state that's tried it, and Teresa Pasquini's here, and she can talk about some of the results they've had in various counties in California with it. But AOT reduces incarceration, homelessness, arrests in the 70% range. People who are in it, 80% says it helps them get well and stay well. That's not what the federally funded peer advocates are saying, but that's what the research shows. And what this is showing, it's showing rates of incarceration, the blue line, rates of homelessness, rates of hospitalization before people went into AOT and what the rates were, and you see they went down dramatically in each case. This is New York, but this research has held up wherever it's been tried. Mental health courts also keep people in treatment, but mental health courts only happen after someone has committed a crime. AOT does before a crime has been committed, essentially what mental health courts do after. And here's the killer. You have somebody with serious mental illness, the mental health system won't treat them, so they commit a crime, they go to court, and the court orders the mental health system to treat them. It is a long, unnecessary round trip that could be prevented if we would force the mental health system to focus on the seriously mentally ill. And the question came up, well, what if there are no services? Well, every mental health department I know is wasting money on pop psychology and useless programs. So if courts order somebody into treatment, the mental health system may have to cut out some of those programs in order to fund it. So ways to expand AOT in mental health courts, highlight it both to your mental health officials and criminal justice officials, ask legislators, because the mental health department generally isn't going to volunteer to set up a AOT program. Because of this difficulty in getting funding and because of the difficulty of patients, most community programs, there are exceptions, want the easiest, they want to cherry pick the easiest to treat. And to the extent that AOT and mental health courts force them to treat the seriously ill, it's not really something they're interested in, so we got to go over their heads. Other groups, business improvement districts, I don't know if Carrie's here. Yeah, Carrie is an idol of mine. I urge you to list her. Anyway, she'll explain, but she's she comes at this from the business improvement districts and how they got involved in this issue. Taxpayer groups, good governance groups, not mental health groups. Highlight, somebody said how Steve Leifman, another hero of mine, has been using the media. The public is only going to support this. As I said, I don't think it's because it's the right thing to do. I don't necessarily think it's because of economics. They will support it because it makes their lives better. It can reduce homelessness, it reduces risk to the public. So when there is a mass tragedy, the media is going to report on that, or even not a mass tragedy. And isn't it better if they have our solutions as part of that? And I write tons of op-eds. I don't even try to submit them unless there's been a tragedy, and then I change the first sentence, because the only time people are interested in this is when there's a tragedy, because it makes their lives better. So we have to end the mental illness to jail pipeline. We have to support the things criminal justice has been asking for, which is civil commitment, AOT, mental health courts, hospitals, forensic parole, alternatives to incarceration. I haven't talked enough about housing. Housing's a huge, huge need, and I apologize for not talking more about that. Very important. Just ask your county or your state, require your mental health department to measure and report on meaningful metrics. That includes the number of homeless who are mentally ill, the number of mentally ill who are arrested and incarcerated or needlessly hospitalized, the so-called round trippers or frequent flyers. Ask them to report on that and measure them against that. We mental health advocates have to listen to criminal justice. Throwing money at mental health is not the same as treating the seriously ill. We have to stop focusing on solutions that do not reduce homelessness, arrest, incarceration, and needless hospitalization. And there's a whole bunch of those that don't do it. Risk factors, and my book goes into a lot of this. I'm not going to talk about them. No, happiness treatment, treatments to improve mental wellness in the masses. Prevention is a huge one. Everyone goes in front of a legislator. If we intervene early, we can prevent mental illness. Nonsense. Schizophrenia and bipolar, to make up the bulk of the seriously mentally ill, cannot be prevented. There will be a Nobel Prize to whoever figures that out. So when someone goes in front of a legislator and says, if we intervene early, we can prevent mental illness, they're lying. We can prevent progression, and first episode psychosis programs do that. But they are treating people who already had a first episode psychosis, and the average age, I forget if it's average or median, is about 23. These are not programs for kids in elementary school. Mental wellness, bullying, and the big one is stigma. I'm going to go into this a little bit briefly because stigma is what this concept of saying that stigma is the biggest barrier to care is nonsense. And I am so happy that today I didn't hear any talk about stigma being the barrier. What I heard about was what every mom knows. The biggest barrier to getting care for someone with serious mental illness is that there's no hospital beds. I have to wait till they become dangerous. There's no doctors or case managers. There's no services. There's no housing. There's no clubhouses. The cost is too high. The person doesn't have insurance. They don't have transportation. It's a big one in rural areas. The hours of the treatment program are too limited. The person has anosognosia. They don't even know they're ill. Every mom knows these are far bigger barriers to care than stigma. And the providers know that you're not reimbursed enough, so you can't hire the best staff. Actually, you're hiring really terrific staff, but you can't stop the turnover. The movie last night showed that a woman who was exceedingly dedicated, but she left that program. There's too much staff turnover. There's too high caseloads. These are far bigger barriers to stigma. We have to change the practices and policies, the discriminatory policies that create those. So judges, I'm asking you, trust your own judgment. Don't believe a lot of what mental health advocates say. You are now the experts on this. And for us mental health advocates, we have to start listening to those things that criminal justice is telling us are really needed. As a result of our advocacy, we are now spending way too much on mental health. We're spending way too little on serious mental illness. If we work together, we can return care and treatment of the seriously mentally ill away from criminal justice and turn it back to the mental health departments. And that's what we should all be working to do. I thank you. I'm going to have my book outside, and please follow us on social media. Thank you.